agents are telling me different things. So I called my ACA agent, the guy who signed me up for it, and he told me to call Social Security to apply for Medicare. But I called them, and I was on a hold for an hour. I was like, hold on. We're going to send someone to you, and we're going to help you get enrolled in it. He was like, really? Man, that's so helpful. Yeah, it's super easy. We just help you do it on Social Security website, and we'll help you with all that. And he was like really, really appreciative. I guarantee you that ACA agent just lost turning 65, new to Medicare enrollment because they simply decided not to help somebody. Right. Yeah. So the agent that we sent is really good and is going to end up being their agent from here on out. So it's a note. You've got to be willing to do things for other people, even when you're not getting paid, even when your time is valuable, because all of our time is valuable.
The question that we get from agents, and I know a lot of you probably have the same question, is, can I move somebody from a Medicare Advantage plan in the month of June, for example, over to a Medicare supplement plan? And the answer to that, it's a little more complicated than, just simply, because you still need to find an enrollment period to move them off of their Medicare Advantage plan into a prescription drug plan. They'd have to have an SEP for that.
Yeah, I would say for the most part, if it's after March, the answer is no, unless you have that. There's
some disaster SEPs or whatnot out there.
But outside of having some disaster or in kind of thinking the other option as of right now until next year would be like LIS or anything like that. I think that would, but outside of that, the answer is really no. Right. outside of that. So
if they've got a Medicare Advantage plan, but if they're already on a SUP, you can absolutely any time of the year you can write them onto another SUP.
Yeah, one thing. Hey everybody, welcome back to Medicare Agent IQ. I'm Raul Gonzalez.
And I'm Oscar Ibieta.
And this is episode 67. You believe that?
67.
Been doing this a long time, and really happy. We continue to get messages from agents, and it's interesting to me because it's a lot of new agents, a lot of people like reaching out. Hey, I just started listening like 3 weeks ago or whatever it is. It's really cool, and we're excited to kind of be part of the journey for Medicare agents. So
it's been a fun ride. I feel like I tell a lighthearted joke. I think the first episode that we recorded, we had just a handful of listeners, and I think we were a good fraction of that. You and I and our wives probably.
I listened to it like 10 times, and we're like, man, there's got a lot of listens. It was me.
Yeah, but it's cool to see how the footprint has expanded through so many different states, and I love seeing the messages come in. It's a rewarding feeling for us on our end. I love it.
Yeah, keep in mind, like we don't do any kind of recruiting or anything like that here. This is primarily just to help other people, and just kind of like, there's a lot of agents out there that don't have like a lot of support. Maybe they chose an upline that is kind of more focused on the national production and instead of like one agent, and they'll pick up agents that way. But I think that there's always some value in having someone, and if you don't, we hope to just be that kind of resource for you. So hey, I was thinking about it, and Oscar and I were talking about it. So the last couple of weeks we did some questions from agents, and right now I'm just kind of thinking about how we could what's the move here? What did I say?
What's the move?
What's the move? Like if you're an agent, you're out in the field and you run into one of these kind of questions, it's like, what's the move? What would we do? How would we direct you? How would we what would we tell a client in your situation? And so
so these are, we've kind of taken some questions, some different scenarios that we've gotten from agents that work with us when they're out in the field. And
this is actually real scenarios that we use when in our training for our agency. Like we train agents using these real scenarios. And so just kind of, I feel like the best value in this is when we have these kinds of dialogues where it's not like completely planned, and so we ask these questions, and then we talk and then see what it kind of turns into. So let's go through. So what's the move here? Scenario 1, I wrote a client into a Medicare supplement with an effective date for next month. He was supposed to sign up for Part B, but he forgot, and it's been a little over a year since he lost his employer coverage and should have enrolled in Medicare Part B. Is he out of luck?
So the answer is, for now, he's out of luck. Yes, he is. So he's going to have to wait until the GEP, the general enrollment period. And so this is one of those scenarios where you want to be familiar with enrollment periods. You've got to know, everybody knows what IEP is, the initial enrollment period. And then we've all come to know what OEP is. But then there are these other enrollment periods, and there's the GEP, which I feel like sometimes people just kind of overlooked at, or maybe you get trained on it once and then you really don't look back on it until you run into a situation where you actually need it or it comes into play.
The reason is that the IEP and the ICEP and all that's for enrollment into Medicare Advantage or Medicare prescription drug plan. When we're talking about the GEP, that's specific to enrolling in original Medicare for Medicare Part B. So I think that's a lot of times agents are kind of focusing on enrollment periods for Advantage plans. And so there's also these others, and that is a general enrollment period. So it's kind of, in some ways it's frustrating, right? Like, oh, well, this particular individual, he's going to have to wait. And I know it doesn't feel good to have to wait, but the reality is, back when I was first starting in this business and really up until a couple of years ago, they would have to wait between the months of January and March to enroll in the general enrollment period. And then once they enrolled, they would still start July 1st. So that was kind of a frustration. Like if they forgot to enroll in it's April.
Well, here we are now, right? It's August.
Yeah. No, you're absolutely right.
This is the situation. This is the scenario. You're trying to get them enrolled into a plan for next month, a Medicare supplement plan, but they never enrolled into Part B.
Right.
And it's been over a year since they lost their employer group health coverage. So that 8-month SEP that they have to enroll into Part B, that window has closed, right? That door has closed. So now what? And so now they've got to wait until the general enrollment period, which is January, February, and March. And like you said, up until a couple of years ago, even when you wait until January, February, March, that Part B won't go into effect until July 1st.
Yeah, and now you appreciate that if they do, and if this particular individual were to enroll in January, on January the 3rd, they went down and they enrolled, they will start Medicare February 1st, where they used to have to wait all the way till July. So we're in August, and they would have had to wait till July,
almost
which is
a year.
Yeah, which wasn't fair, and so some people would end up going and taking a job so they can get health insurance. I was just going to ask, like, I'm going to throw a monkey wrench. Is that I don't know what the
just a wrench.
Yeah, okay. I'm gonna throw a wrench out there, and in what would they do? So they've got this 5-month waiting period that they're going to have to wait. What's the move there? Like how do they get coverage?
Well, they can go and find a job, but even then, when you get a job, sometimes they've
3
got
months.
like a probation period before they'll offer you health insurance. Another alternative option I'm thinking, if it's me in that situation, I might try and get like a private health insurance plan, not so much an ACA plan, because I don't think that I'm not super familiar with ACA, but I don't know that they'd have an SEP to enroll into an ACA plan.
No SEP, right?
So they might have to just try to see if they can get like a maybe short-term medical plan or one of those private health insurance plans.
There's so many changes, and listen, I'll be the first to tell everybody, like, we're in Medicare Advantage, like that's our expertise. We do some ACA, it's not our wheelhouse necessarily, but I understand that there were some changes made to short-term medical insurance that I don't even know what that move is there. And if you are someone who specializes in individual insurance, feel free to let us know if there's something we're missing here, and we'll share it on the next episode. But there's not a whole lot of moves other than maybe trying to see if you can find a job. Now it's not as big of a deal, right? Like 5 months, and unless you actually need care. But one other thing I would throw out is there are some counties right now that are that have those natural disasters, and they've got SEPs to enroll in an MA. I imagine with all of that they could call in, and I actually had someone mention that before. Another one of our agents, and I said, hey, why don't you just have them call and say, hey, the reason I couldn't enroll is because of the border disaster or whatever it is, and
the wildfires, the flooding.
Yeah, and so we've
seen some exceptions to that, but I will also say it's not like this is just you can.
It's not the fix.
There's an SEP for the Advantage plan, so you can you should be able to use it for enrolling into Part B. That's not what we're saying.
But it's always worth a try.
It is always worth a try because at this point you're the one having to deliver that news. Hey, look, we're going to have to wait until the general enrollment period. Unfortunately, this is just how the Medicare rules are, and we've got to play by those rules. But maybe there's something that you could have done, or maybe just like a best practice, just looking over this scenario here. How long have you been working with this client? Now, if you just met them, then there's really not a whole lot that you could have done. But if you've been working with them for a little while now, I think it's our job, it's our responsibility to continue to remind them and say, hey, look, you've got to make sure you go and enroll into Part B if they're still within that that 8-month SEP to enroll into Part B from the time that they lost their employer group health coverage. Because if they don't, then you're going to end up in a situation like this where they've got to wait until the general enrollment period. So there's some responsibility that I feel that we have on our end as agents to take care of our clients or our future clients, and because again, they don't know all these rules. They don't sit through trainings the way that we do, and so we have to be the ones to educate them and inform them, and really just kind of take them by the hand and walk them through this journey.
Yeah, I think as an agent, like marketing yourself as an individual that knows all of these rules, that I want to be a resource for people turning 65, and I'm going to give you the right answers. I'm going to know what the rules are about late enrollment penalties if you choose not to enroll in a Medicare, in original Medicare. I'm going to know all of these rules, and I'm going to give you guidance. And the hard part is I have seen in the past where agents gave wrong guidance to seniors. Agents were told like, hey, you don't need to get Medicare, you don't need to sign up for Medicare for this reason, and then turns out they did, and they end up getting a late enrollment penalty. Hard part about that, and this is why it's such a big deal for us agents, is the struggle is that these are lifetime penalties. It's not like, okay, well, you made a mistake and it's no big deal. It's like, man, if you tell people wrong, it could affect them for, if they work until they're 70, it could really affect them for a long time. So.
Yeah, to kind of going on maybe a little soapbox here, but I think it's also important to understand how to help people enroll into Medicare Part B, because think about it like this, as an agent, and this being our industry and a part of what we do, of course, we all know that we don't get paid to help people sign up for Part B and enroll into Part B. That's not where we make our money. We make our money when we enroll them into an Advantage plan, a supplement, or a prescription drug plan. But this is a part of what we do, and I think it's important for us to understand how to go through this process with people, because when you're dealing with an individual who has to do this, think about it like this. And I tell my clients all the time, look, you're only going to have to do this one time in your life, usually, right? There are some exceptions to that, but for the most part, these people are only going to have to go through this transition one time. But for me, as an agent, gosh, I feel like I help people go through this multiple times a month, just signing up for their Medicare when they're going to be brand new to it, or if they're retiring, or if they're coming off of their group coverage. So I challenge you, if you're not familiar with the process of enrolling into Part B or enrolling into Medicare, I think it's important, and it makes you that much more valuable when you're talking to people and when you're meeting with them, because you can make them a lot more comfortable from the very beginning, and now they trust you because you've helped them from the very beginning all the way to that finish line. They're like, I didn't have to do anything.
Yeah,
my agent helped me do it all.
Man, I want to share real quick something that happened like literally 2 days ago. So I got a call at our office, and it was a gentleman. He was like, hey, I've been getting mixed information, and I was just curious if I was told I need to sign up for Medicare, and I wanted to just stay on my ACA plan, and then but agents are telling me different things. So I called my ACA agent, the guy who signed me up for it, and he told me to call Social Security to apply for Medicare. But I called them, and I was on a hold for an hour. I was like, hold on. we're going to send someone to you and
Yeah.
we're going to help you get enrolled in it. He was like, really? Man, that's so helpful. Yeah, it's super easy. We just help you do it on Social Security website, and we'll help you with all that. And he was like really, really appreciative. I guarantee you that ACA agent just lost turning 65, new to Medicare enrollment because they simply decided not to help somebody. Right.
Yeah.
So the agent that we sent is really good and is going to end up being their agent from here on out. So it's a note. You've got to be willing to do things for other people, even when you're not getting paid, even when your time is valuable, because all of our time is valuable.
Yeah.
So, all right, let's go on to the next one. Unless you had anything else you wanted to throw on that.
Move on.
Okay. I have a client who needs hip surgery. He's currently enrolled in a Medicare Advantage plan and wants to switch to a Medicare supplement. When's the best time to write him into a plan?
So if he wants to, if he's wanting to get into a Medicare supplement plan, he's probably going to have to wait until after that surgery, because when you look at the questionnaire, so he's going to have to go through underwriting for a Medicare supplement, assuming he's not, within the first 6 months or even a year of being on Medicare. It's going to have to go through underwriting, which means he's going to have to answer a number of health questions. And one of the questions that's going to be on there is, do you have any pending surgeries? Right. And the answer in this case is yes. So because of that, it's likely going to get declined by the carrier. So what do we do in this situation? We're going to have to wait until after that surgery, assuming that they may be able to pass underwriting with all the other questions that are going to be asked. But that would be the time to do it, because we know right now that it'll be declined if we tried applying for it.
Oh yeah, for sure. And there's no guarantee that he'll get it at that time. If it's October 15th, and you may want to let them know, hey, look, we may end up having to wait until, really you can disenroll from your Advantage plan all the way up through March 31st. Yeah. So if that surgery is scheduled for December, then after that surgery, then we can go ahead and try to get you through underwriting in January. So it will take some time, make sure. And then if that surgery is not done by March 31st, really need to wait until next open enrollment period before they'd be able to do that.
Yeah, that's right. Yeah. And I want to speak to something a little bit, just kind of going off of this. So Medicare supplement business, it is a year-round business. However, it can be year-round when you're writing somebody from one supplement to another Medicare supplement, which means you're not messing with their prescription drug coverage whatsoever. But if you meet somebody in June, in the middle of the summer, and they're wanting to go from an Advantage plan over to a Medicare supplement, healthy individual, that they're likely going to pass the underwriting. A question that we get from agents, and I know a lot of you probably have the same question, is, can I move somebody from a Medicare Advantage plan in the month of June, for example, over to a Medicare supplement plan? And the answer to that, it's a little more complicated than, just simply, because you still need to find an enrollment period to move them off of their Medicare Advantage plan into a prescription drug plan. They'd have to have an SEP for that. Yeah,
I would say for the most part, if it's after March, the answer is no, unless you have that.
There's some disaster SEPs or whatnot out there.
But outside of having some disaster or kind of thinking the other option as of right now until next year would be like LIS or anything like that. I think that would, but outside of that, the answer is really no. Right. outside of that. So
if they've got a Medicare Advantage plan, but if they're already on a SUP, you can absolutely any time of the year you can write them onto another SUP.
Yeah, one thing I want to throw out also and just kind of let people know is I used to work at Humana, and when I worked there, I primarily focused on Advantage plans. It was really kind of what we did. And this is, I started working there in 2007. It was 2007. So quite a long time ago. But back then we really focused on Advantage, and they preferred Advantage. Like they overpriced their supplement just so we would sell Advantage, right? Like they had it, but it was specific. Like they really did want to overprice it. So I didn't know enough about it. And so when someone would tell me, I want to leave an Advantage plan and go on to a Medicare supplement. My initial thought was, oh, you're not going to pass underwriting, but to be real honest, I think a lot of companies are pretty lenient, and unless you've got, even if people have diabetes, plans will take them. Some of them will have this rule about, well, how much insulin are they taking, or or is it under control? Are they taking their meds? Those types of questions. And a lot of times if they're compliant with those things and they're not on insulin or on a lot of insulin, they could still get approved. So I just want to encourage everybody, don't get caught in this thing like, well, if someone wants a supplement moving from an Advantage plan or even moving from one supplement to the other, that they're not going to make it, because there's a lot of there's just a lot of leniency, a lot of flexibility when it comes to that.
Yeah, and a lot of these carriers have a department when you call into the broker services where they've got an underwriting department that can help you work through some of these questions that you may have. So if you've got a diabetic and they're taking, 2 medications, you can call in to the department and say, hey, look, I'm going to meet with somebody who is considering a Medicare supplement plan. One of the questions on the application is asking about diabetes. Can you help me work through this? And they will talk you through it and say, no, you can still move forward with the application. Or they could also help you determine, hey, look, because they're on 3 more than 2 diabetic medications, it's likely going to get declined. So no need in moving forward with the application.
Right. Let's move on to the next one here. And it says, I met with a woman who just aged into Medicare and takes several medications costing thousands of dollars monthly. I'm assuming that's the cost of the medication. Yeah. And it said she only makes $700 a month. How can I help?
That's an easy one.
Right.
First thought that comes to my mind, LIS. Right? It sounds to me like they likely qualify for the LIS program. And so what that's going to do is that's going to quickly eliminate any concerns when it comes to the cost of the medications, at least incurring, those high copays and hitting the donut hole. Sorry. If you get them on LIS, that they're going to get heavily discounted medications when they go down to the pharmacy and pick up their meds.
Yeah. And the other thing is, if it's $700 a month, I'm probably thinking that they're going to qualify for more than just LIS. And so for most states, and so every state is different and everyone has their own, that's kind of the hard part, is like when you do a national podcast, right, there are some differences. And so most of the things that we talk about apply to most states. And of course there's those unique states that kind of like jump out when it comes to Medicare supplement enrollment rules and things like that. But for the most part, we're giving advice for what works nationally. And I would say that if someone is at $700 a month income, very likely that they're going to qualify for Medicaid and get much more help. But I want to take that even a step further. And I just kind of want to encourage you, if you're an agent and you're working here, your job kind of, obviously you're hoping to make money, but one of the things that you're here to do is to serve senior citizens, especially if you receive kind of a lead from a low income senior citizen that's making only $700 a month. Gosh, are there nonprofits in your area that can serve them also? There's so many different things, so many nonprofits available. And I would recommend, this is kind of a side note to this actual question, but I would recommend getting to know the nonprofits out there that serve seniors. And there's even ones out there that will help with transportation. And so it just, every city, every town is different. So get to know them a little bit, and just, you're there to help people in life, and then thankfully we get to get paid to do it. But man, like if you can find the nonprofits that are serving those seniors, I think it's a good thing too. Yeah. But help them apply for Medicaid. So just real quick, there's in every state's different, but like here in Texas, we recommend our agents, like, hey, it's, there's this application. To be real honest, a lot of the people who are on Medicaid struggle to read, and that's not a judgment on anyone. This is just it's an unfortunate reality. So because of that, I would say that if you could if you have the time to help people apply for Medicaid, I would. There's also a couple of nonprofits out there, depending on where you live. There could be nonprofits that help people apply for it, or they could call their Health and Human Services department. And there are some people there that will help them. I think that a lot of times they struggle when they call those numbers, and it's struggle to do it all over the phone. So if you can help people, by all means, do it. I do know that there's some agents out there that say, I never do that. That's not my role. That's completely up to you. But there are agents out there that will do it. A lot of times those agents that will help them get that loyalty, that long-term loyalty. Like, man, these guys help me with this. These other people, no, I'm not going to give up that help.
Right. Yeah. And when talking about, applying for the LIS program and the Medicaid program, so most of the time when somebody applies for Medicaid and gets approved, they are usually also enrolled into the LIS program. But let me be clear that they're two separate programs. And so a lot of times they're also two separate applications. And right. So we all know, the process to enroll into Medicaid, to apply for Medicaid and to let it process and kind of run its course through the system can take a little while. I mean, it can take it can be 8 weeks. It can take longer than that. And so having to wait that much time for that to be approved, and then once that's approved, like I said, they are usually enrolled into the LIS program. Well, that means that we're 2 or 3 months away from this woman that I'm meeting with. We're 2 or 3 months away from her getting her discounts on her medication. So that's why you've got to take it upon yourself as the agent to help them apply for the LIS program online. It's a quick, you can have it done in less than 10 minutes, maybe even 5 minutes online. And so you can go and help them apply for that, and they can get approved in as quickly as 2 weeks.
It's pretty quick, right?
It's the turnaround time on that. So now instead of you being 2 or 3 months away from her getting discounts on her medications, which was the main concern in this particular scenario, you can get them. They can start getting discounts on those medications in as little as 2 weeks. So here's how that plays out. Hey, look, these are two separate programs. You may qualify for both. Again, I never tell them you are going to qualify for both or you will qualify. You never. Yeah,
you never
promises.
know. Like, there's people out there that they have very low income, but then turns out they've got like $3 million in there.
Right. Or they own multiple, properties or something like that. And that can disqualify them from some of these programs. But so that's why you say you may qualify for this program. So what I'm going to do is I'm going to help you apply for this program here, the LIS program. What that's going to do is that's going to get you discounts on your medications. And I'm also going to help you apply for the Medicaid program. But this one's going to take a little bit longer. It may require some paperwork that we'll have to submit. But we need to get you discounts on your medications now. So let's do this first, and then we'll move on from there on to getting you onto the Medicaid plan. And again, that's going to lead to loyalty. It's going to lead to higher retention. It's going to lead to referrals. In this business, we get into this business for the residuals, and you talk about, we always use the term sticky book, building a sticky book. This is one of those practices that you can easily and quickly implement into your day-to-day that's going to help you grow a sticky book. And so I challenge you, again, go and look at the LIS application online, see what that looks like. And correct me if I'm wrong here, Raul, but I've never found a paper LIS application. I know that they're out there, but they're usually addressed to the individual at the time that they initially qualify for Medicare, and it's already pre-filled with their information. I've never found a blank LIS application, and I've tried pretty hard to find it. Maybe you've seen it. If you have, share it with me, please. But usually but also, if there is a paper app out there, you do the online app. It's a lot easier to fill out, and there's less room for error when you do the online application. So go and do it that way. Get familiar with it, and also get familiar with filling out the Medicaid application and the process and how that works. So that way, when you're out in the field, it brings that much more value to you when you're meeting with your clients. I
feel like you kept talking because you felt like I was going to correct you right now. No, so I will say that back in when I first started doing this, there were actual paper LIS applications. You can pick them up at the Social Security office, and you could print them online. But no, I haven't seen them in years. Yeah. But yeah, I would say that that if you, like the option at this point, or the answer is always yes, do it online. Like do it electronically. There's no reason to not. Hey, I'm going to jump ahead, and I know we have more questions, but I feel like your question is going to take a lot longer to answer, and I think we'll do that next week.
Okay.
Just kind of a quick one, and this question is a question that came up from one of our agents the other day, and so she sent me a text, and she said, "Hey, a client just called and is in the donut hole. He asked if he moved from United Healthcare over to Humana, will it restart his donut hole?" So let's just say that it's important to make a note here. This is August 2024. So starting in January 2025, the rules are going to change. So we're going to answer this question for today. You want to answer it?
So the donut hole does not reset. They will remain in the donut hole if they move from one plan to another, one carrier to another. That where they're at in the donut hole phase, they will remain in that phase, in that part,
right?
Whether they choose to stay on the plan or if they make a change.
Yeah. And I would, so obviously that's a very easy answer, but I'm going to go ahead and add to that real quick, and let's start talking about what happens with the maximum out of pocket on a Medicare Advantage plan, because that is something that sometimes it's important to know. So it kind of gets me off of that question into something else that's super important. When you are changing someone over from one Medicare Advantage plan to another, it's important to ask all the questions, right? Like if someone tells you, "Yeah, I've been dealing with cancer, and I've been doing chemotherapy, but all my doctors are in network, so I want to make the change." There's still something that should make you think and make you stop. And one of those things is that when someone changes from one plan to another, their max out of pocket for the most part will reset. Yeah. And so if you move someone over from Humana over to United, that could put them in a very, very tough situation where if they were just about to meet their max out of pocket and it's August and you make the move right now, they're just about to hit it, and then you move them, then all of a sudden they go back to zero, or worse, they were already paying zero for everything, and then you make that move and their max out of pocket resets. So the only time it doesn't is as they have the same contract number. So that first 5 digits, when you look at the plan, it might be, so here in San Antonio, H4510, right? And then it's got dash 023 or whatever it is, right? If they have the same first 5 digits, that same contract number, then it does not reset the max out of pocket. Every other plan change that you do will, and it's something that requires some thought. You want to make sure not to hurt somebody. We're here to help people, right? Let's make sure that we know these kind of important things, so that way we're not putting people in a rough situation.
Yeah. Yep.
So, hey, did you have anything else to add to that? So we're going to go ahead and wrap it up right there, and we're going to just go ahead and continue doing these what's the move here, and we'll continue on with them next week. But just kind of want to encourage everybody. Look, we're getting closer to AEP. We're getting, like, right now, I kind of like I think about like Gladiator, right? And you're thinking about, or whatever it is. If I think everyone's seen Gladiator, right? Like
your favorite movie.
This is one of those things where like I'm too old now, but there's a movie that where people are getting ready for battle. They're getting ready to go out there, and you start putting on your war paint. You start putting on your gear. That's where we're at right now. We're in August, and this is going to be a great opportunity. This AEP, and like people were saying, like at first it kind of looked like it was going to be just crazy,
a bloodbath.
Yeah, it really did. And now it's going to be a little bit. It's not as bad. You start looking at the first looks and everything. It's not as bad as we
also depends on the market, right?
Yeah, you're right, because there's a lot of people in certain markets that are going to be very effective, but some markets it's not going to be as bad as we thought. And so, but it's a great opportunity. This AEP is going to be one for the record books if you do a good job of it. So get ready, stay focused. One thing I would encourage you to do is to listen to this podcast, listen to the other ones out there. There's a lot of good podcasts. I listen to some of the other Medicare podcasts. It's good stuff. Stay focused. When you're in the car, instead of listening to music or instead of listening to kind of like entertaining podcasts, throw this one on, throw the other guys on, and stay focused, get motivated, and go out there and make this your best AEP. So until next time, get ready. It's going to be a big one.